Hi, my name is Carolyn, Whiskin pharmacist, and today on Real Life we're going to talk about pain. Chronic pain is very undertreated in Canada, and because of that we need to find as many ways as possible to treat pain. We know that pain does serve a necessary function. If you take your hand and put it on a heart burner, you want it to hurt, so you'll remove your hand. But after 3 months of ongoing pain, whether it's after surgery or an accident, that pain should no longer exist. It's not serving a protective function, and it really needs to be addressed. When we're looking at pain generally, there are many causes of it. So inflammation is one that is a large area that we can treat. Another one might be nerve pain. Another one could be myofascial pain. So I'm going to look at all three of these areas and talk about some of the non-prescription items you can use. And certainly if those aren't effective, there are prescription options as well. So let's start with inflammation. Many people will have joint pain, arthritis due to inflammation and swelling. And we know that a lot of the products that are taken that are anti-inflammatory can irritate the stomach lining, may cause fluid retention, and that in turn can raise blood pressure. So not everyone is a candidate to take an anti-inflammatory drug such as ibuprofen or Advil. That would be, and I'll show you here, ibuprofen or Advil is a brand name, Motrin. This is a product that does reduce inflammation and swelling, but as I mentioned, does have those potential side effects of irritating the stomach, causing fluid retention. So taking it after something to eat is very important. And also to make sure that you check with your physician if you're using an extensive amount of this, because a prescription stomach protectant may be necessary. Tylenol, which we think about all the time as a general painkiller, is great for overall pain, fever, but it doesn't have anti-inflammatory benefit, so it won't reduce inflammation and swelling. It does, however, help for things like osteoarthritis, because certainly there is generalized pain associated with that, and it may be helpful. In fact, you can use an anti-inflammatory like ibuprofen or Advil in combination with Tylenol, also known as acetaminophen. They can be taken right together because they are working differently. But if we move away from those two, which are the most traditional options that people think of for pain, there are some also great products that can really reduce inflammation. One of those is known as Trameal. It's a homeopathic product commonly recommended by chiropractors, naturopaths, and also pharmacists. It can be rubbed on a joint and it will reduce inflammation, also reduce bruising. So it is great after any kind of trauma, which is why it's referred to as Trameal. It comes in ointment and creams, and also in a drop or pellet you can put in the mouth. And using the two together, something on the skin and something in the mouth, actually increases the chance of benefit. So here's a nice product that can be carried with you. I often like to think of it as first aid because it works so well to reduce inflammation, and certainly right after an accident or injury. Wenbenzyme is another product that is amazing for getting rid of inflammation in the system. It actually is a group of enzymes that processes inflammation out of the body, and this can be used in addition with other products. So it's not that you couldn't use Trameal on your skin, you couldn't be taking Tylenol, but this is a great option. It's actually the #2 non-prescription drug in Germany, and it will not only process inflammation out of the body through its enzymes, it also helps digest food a little bit more efficiently. So when you first start taking it, you may go to the bathroom more often, so I normally suggest people start low and then slowly work up their dose. There is an ingredient in here that can affect blood clotting to a small extent, similar to a low-dose aspirin, but that would be a caution for someone on a prescription blood thinner. In addition to that, MSM is another product that is a natural supplement, and it helps to remove inflammation from the body. In fact, MSM is a chemical that's naturally occurring in the rain. It should be in all of our fruits and vegetables, but we often don't get enough of it. And it will promote us getting rid of inflammatory chemicals like prostaglandin out of our system. It will reduce inflammation anywhere in the body. So whether it's sinusitis, whether it's in the lungs, whether it's in joints, it will help with that. One of my favorite products is fish oil. And omega-3 fish oil I'm going to grab from the shelf. Several different options exist. Nutri-C is one of the top fish oils in Canada, and one of the things you're looking for in a fish oil product is that it is microfiltered, that all the contaminants have been removed, because when we look at fish oil, which is rich in omega-3, there is mercury in the ocean, there are dioxins, lots of things that we want to get rid of. So a product that ensures those have been cleared and properly microfiltered is really important. When we're looking for a fish oil that's going to help with inflammation, the important ingredient to look for is EPA. EPA and DHA are the two main components of omega-3 fish oil. And when you look on the side of a bottle, you will see a mixture breakdown or a breakdown of what's in that product. And the EPA content being high is really important for getting that anti-inflammatory benefit. So in this particular product, 1 teaspoon would have 1,500 milligrams of EPA and 500 of DHA, which is excellent. So the more you can get of that ingredient, the better. And the liquid, what's nice about it is it can be mixed with juice, with hot cereal, anything like that. This does not taste like cod liver oil. It is lemon flavored, so it's easy to mix with foods or drinks, and a teaspoon a day is often ample. We also have people with osteoarthritis where not only treating inflammation is important, but also nourishing the cartilage. The cartilage is a spongy type of material on the end of the bone that helps cushion the joint, and it starts to break down and deteriorate in osteoarthritis. So what we really want to do is nourish that cartilage, get it rebuilt, and so things like glucosamine and chondroitin are very helpful. This product has glucosamine and chondroitin, which is really food for the joint, but in addition has added some of that MSM I talked about earlier, which is an anti-inflammatory. So that's a very nice combination to help nourish the joint and feed it. It can take up to 3 months for this to really make a difference. So make sure you stick with it if you're going to give it a good try to see if it helps you. Zeal is a product that is in that homeopathic line, really a companion to the Trameal I talked about earlier, but it really helps to get rid of some of that debris and flush out that joint, and works really well with glucosamine and chondroitin for osteoarthritis. So often when people will use a product like Zeal with their glucosamine and chondroitin to maintain that joint and to prevent having to need as many medications to reduce inflammation and swelling. Now I want to show you a product which is rather new on the market. It's called Voltaren Emu Gel. And Voltaren is actually originally was a prescription product. It's diclofenac, and it is available in a low strength in a topical form. Certainly in a tablet form it is only available on prescription, but this is an anti-inflammatory, again, that can be rubbed onto areas where there's inflammation and swelling. If that is not enough, of course there are prescription strength anti-inflammatories, and compounding pharmacies can prepare prescription strength anti-inflammatory creams or gels that are rubbed on that are even stronger than what you can get over the counter. Now let's talk for a minute about nerve pain, because that is a huge aspect that people need to look at in terms of pain control. Many people will experience burning, shooting, tingling pain, even loss of sensation. It could be something like neuropathy, where there is a lack of feeling in the feet, which happens commonly in diabetes. So blocking nerve pain transmission is another thing that patients will often need help with. And so there are a couple of products that will do that. Zostrix blocks a chemical called substance P that nerves make, and that helps with nerve-related pain. This product has some menthol added to it because the ingredient that does treat this nerve pain is made from red hot chili peppers, and it can make your skin pretty hot. So adding a bit of menthol can be helpful. So these are a couple of products that can help with nerve pain. Neurogen is another one. It's an oil that can be applied to the skin, and it has been helpful as well. Certainly the prescription products are stronger in this area, and there are topical, in other words creams that can be rubbed on that include several ingredients for nerve pain that you must get a prescription from your physician for, and there's also products you can swallow that are very good at treating nerve-based pain. The last thing I want to mention is what we call myofascial pain. And in fact, most types of pain have a muscle component, meaning that your muscle will tighten around an area that's vulnerable, that's in pain. So if I have sciatica in my back, I've got burning, shooting pain going down my leg, chances are that the pain is not just due to the compressed nerve, but also inflammation and muscle tension in the back, in what we call our gluteus muscles, which we're sitting on. Those will tense up. In cases of osteoarthritis, which I mentioned, not only will we have to look at reducing inflammation and breakdown of cartilage, but we may have a muscle in our leg, this outer quadricep muscle here, can tighten, and a knot will get in the muscle because it's trying so hard to stabilize that joint. And when that happens, it accentuates the pain. So if we look at this little chart here, which we call a trigger point flip chart, you'll see that where the X's are where the knots in muscle commonly exist, and where the red areas are is where the pain happens. So not only does muscle tension make pain worse in a knee from osteoarthritis or going down a leg and sciatica, but it can also be a huge component of headache. So often people who have regular chronic headaches, stretching their neck muscles and using muscle relaxant creams, some which are on prescription, can make a huge difference in helping with that pain. So I hope you get a sense today that treating pain is a multifaceted approach. There's several things that we need to look at, and having a proper assessment to find the cause of that pain will lead to the best possible treatment. In any event, be sure to ask your pharmacist because there are several options available that can be of help.